Right, because I'll be sending this study planner for you guys. Plus, I've kept some, what do you say, flashcards as well. A lot of people, I don't know, you are aware of the flashcards. So we have tried doing one scenario in half page by doing these flashcards. So I have given some, I'll show you, like this. So that's one of the flashcard. I mean, half of the slide we have tried covering the whole scenario. So I will be able to share this PDF with you guys. Yeah. Now, before we begin, I'll just begin in a couple of minutes. Just want to know which area you are joining us from. And please, please, please come in the WhatsApp group if you're not there already. Yeah. Because I can send you this planner once we're done with this session. Yeah. Just tell me which part of the world you are joining us from. If I got a doctor from India, Hyderabad. You've got a doctor from London. Okay. You have a doctor from Edinburgh. Okay, his message in the WhatsApp. Okay. We've got another doctor from Hyderabad, from India, from Karachi, Pakistan, from Delhi, India. Okay, good, 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 good. And just want to know, doctor, because as I was saying, we have doctor from Ghana, from Alexandria, Egypt, UK, India, Nigeria. Okay, so I think from all over the world, I've got the doctors right. From Pakistan, India. Okay, so if I'm doing a session like we're planning to do 1 to 2 hours of session, just the practice session, right? It's going to be free. So, what do you think is the best time according to the UK timings? What is the best time you feel it can be? Should it be in the morning time or in the evening time? Yes, yes. There are many people commenting in the WhatsApp group. So yeah, 10 p.m. 10 p.m. UK Standard Time. That's gonna be, oh, no, 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 no. 11, 12, 11, 6 p.m. This time is best. You mean 11 o'clock. Morning is good. Okay. 10 a.m. Okay. Hmm. I'm just worried because again, a lot of you might be working as well. So if it is 10 a.m. in the UK, your country, I don't know what time it's gonna be. And if you're working, then it's gonna be a problem. So I was thinking maybe a bit evening time, but I think here most of you saying it's morning because huh. Because this webinar when I announced, I wasn't sure should I do it in the morning or in the late evening. One of the reason also that you guys are saying morning because you are able to join this webinar in the morning, so I hope you will be able to join the next ones as well. That's one of the reasons as well. Okay, so I think 11 is 10, 11 is most of you that you're recommending. Okay, so okay, that's fine. That's doable. Mhm. All right, all right, all right. So let's begin then. Just scan this QR code if you have not done. Doctor, is it paid one webinar? No, I'm talking about the free ones. Right, I'm planning for like weekly once or twice, 1 to 2 hours practice session. Free webinars. Yeah, that's what we're planning from next week, probably. Yeah, perfect. And also, join us on our social media as well. I'm not sure if you have joined me or not because the thing is, I have just started putting lots of what do you say, the web small videos on Instagram as well. You'll see all the news stations have been covered there. So if you have not, please join me on Instagram as well. Find me if you can find me. My ID Dr. Ankur Garg. Yeah. So you'll see all the news stations I've covered there as well. For example, the news stations I'm talking about is female genital mutilation. We have got, for example, hyperhidrosis, olecranon bursitis, herpes zoster ophthalmicus, cradle cap, Huntington's, Down syndrome, counseling. We have got tinea pedis, onychomycosis, plantar fasciitis, Morton's neuroma, erythema beginning, rosacea, HIV in pregnancy. So all these are like hot topics in PLAB 2, right? I know these webinars, obviously, we are doing, but you can't record all these webinars, and then it's going to be difficult for you to see as well, isn't it? So I've just made like one minute video as well. So if you would like, you can just join me there. That will be quite helpful. Yeah. Just check it out, Dr. Ankur. Yeah. Any questions if you have got? Doctor, taking only online, is it good to pass PLAB 2? Many of our friends joining online saying it's good to go. Yeah. See, yes, online live, if for example, see, if you see our courses, what we do is we do live telecast all our sessions. There's a difference between online live and recorded session. I would prefer you go for live sessions. Online, maybe you can do those online as well, but at least you'll be able to see others practicing. That should be fine. But then you have to come to the academy at least a couple of weeks before your exam so you can actually practice on the mannequins. Ethics, counseling, and all those stations definitely you can do online. That's not a big deal, isn't it? But what about mannequins? What about SimMan? That has to be done in person. So yes, what you can do is first you can do online live from your home, and then at least 3-4 weeks you spend in the academy, do the mocks and practice on the mannequins. And I think that should be fine. Yeah, that's I think your aim should be. Now, let's begin this study planner. Yeah. So what I have done is I have made this study planner according to the Aspire booklet index. Yeah. See, after you're done with any course, for example, you're done with our course, then how should I prepare? I'm going to give you 30 days planner. So even if you want to do it in 15 days, you can do that. So whatever we have written in day 1 and day 2, you can do in day in one day itself. So that shouldn't be a problem. Now, whenever you practice, just make sure of one thing. Do not just do medicine in one day. I've seen what people do. Okay, let's practice medicine today. And then tomorrow, let's practice gynae. Let's practice pediatric. Let's practice psychiatry. Don't do that. My only sincere advice would be mix it up. If you mix it up, you will see you will enjoy practicing, and it's going to stay here as well. For example, you have practiced mannequins today, and after that for 1 week you have not practiced mannequins. You're just doing your medicine, your surgery, your counseling and ethics. Tell me, I'll just tell you one thing, that you will be struggling to do the mannequins after 1 week because you have not done any mannequin for the last 1 week. So what my advice is, mix it up. Daily you have to do everything. Yeah, daily you have to do everything. Do we need to write notes as well? You mean for this webinar? Not really, doctor, not really. I think you're asking for this webinar. No, no, I mean this sheet, I'll be able to give it to you if you are in the WhatsApp group. Yeah. My only advice that I give it to the candidates is you do at least one exam daily. Now they're like, what do you mean by one exam daily? So in the exam, what are the things that you get? You get stations from medicine, you get stations from surgery, gynae, pediatrics, you have got counseling, you have got ethics, you have got examinations, mannequin, sim, and prescription, isn't it? So this is something you have to do when you are practicing as well. You have to do everything daily. So first, let me tell you what actually comes in the exam. So in the exam, what are the main scenarios that you get? Usually we get 2 to 3 examination mannequins plus teaching as well. So examination mannequin, or it can be a teaching station as well. Usually they give us one simman. Usually they give us one prescription. Yeah. What I have seen, 3 stations maybe from counseling, maybe 3 station from ethics. Now, if you see how much we're left with, 3, 3, 6, 9, 10 almost. So 5 to 6 station is gonna be your history. This history could be medicine, gynae, pediatric surgery. So what we have seen mainly, they might be giving you 2 history stations from medicine, 1 from surgery, 1 from psychiatry, 1 from pediatrics, 1 maybe from OBGY. So this is a rough breakdown actually. So what I always advise when you're practicing also, you have to practice every single kind of scenario on the daily basis. Okay. So the plan is like this. We have got more than 500 scenario nowadays, right? But then if you see how many topics we have got around 100 topics, right? What I mean by that, like, okay, for example, it's a Breaking Bad news. So Breaking Bad news, it's one topic, isn't it? But we have got more than like say 6, 7 scenarios on Breaking Bad news. So now it's up to you. Do you consider it as one scenario or you consider it as like 10 scenario, isn't it? So my study planner is what? So What you have to do is on day one, obviously in the beginning, you will start slowly as well. And make sure you don't read everything in one go. I've seen people after the course finishes or when they start preparing for PLAB, what they think is, let me read the material first. See, our material is like, say, more than 1,000 pages. And if you read 1,000 pages, what do you think? How much you'll be able to retain? We can't retain 100% of it. You can only retain maybe 10% of it. But when you read a little bit and you practice and make mistakes and correct yourself, so what you will see, it is gonna stay here for longer as well. And that's what I would like you to do. So in the evening, in the night, what you do, you read. What you read, for example, you read this day one material, right? Whatever I have written. So what I have written here, if you see, from cardiology, I have written some medicine stations. I've written some medicine stations from cardiology. Then I've written some counseling stations as well. Then surgical station, then couple of ethical station, pediatrics, gynecology, psychiatry, and then couple of examination mannequin, one sim and one prescription. So if you see in this way, what you are trying to do, you are doing everything what is going to come in your exam, isn't it? So that's what I always say. This is how you should practice. So in the evening, what you can do, you can read this material. You can read this material from the notes. You can see the recorded videos as well. And I hope you have already attended the session, like the live sessions, in-person sessions, you've already attended those. So that will make your life more easy. So in the night, if you just see the videos and what you see, I mean, read the material, it won't take more than 1 to 2 hours. Then in the morning, what you need to do, you have to have a group, at least 3 to 4 candidates in the group. I always say if you have 4 people, that should be fine. Maybe 2 males, 2 females, that's better. Because, when you practice, there are a lot of questions. A female candidate might be hesitant in asking to a male, and a male candidate might be hesitant in asking to a female. So this is something kind of very natural, isn't it? So that's always say if you have got a group where we have got 2 males and 2 female candidates, that's the best group, right? So next day you'll meet, say for example, 10 o'clock, you guys meet, all of you. And then what you do, you practice these 16, 17 scenarios, right? And I'm not saying every single candidate has to practice all 16, 17 scenario. No. For example, if you see chest pain, chest pain, chest pain. So there are 3, 4, 5 stations on chest pain itself. So you each one of you do at least one chest pain, and that should be fine. So if you are having, for example, 16 scenarios in a day you are doing, if you're doing 16 scenarios in a day, what should be your aim? 4 candidates, so 4 station each if you're able to do. It's not that much, isn't it? So 4 station each, or maybe you can do 6 station each, and that should be fine. Or maybe history, counseling, ethics, 3 station. Every one of you make sure you practice one examination, and symbol and prescription, obviously everyone has to practice. So this way you will see you'll be able to do all 16 station, and each one of you have practiced at least 6 to 7 station. And what do you think, how long it's going to take? I would say it won't take more than 3 to 4 hours. So 3 to 4 hours of practicing, that's what you're doing. And in the night, 1 to 2 hours of reading. So maximum 6 hours you're spending in a day to prepare for this exam. And if you go like this for a month, you will see you are done with reading, you are done with practicing as well. That's how you have to do this exam. Now, if you are like, no, I have to do everything in 15 days, I'm running short of time, what should I do? So what you can do in that situation, you have to just increase the 6 hours to maybe 10, 12 hours. And then what we have in day one and what we have in day two, just combine it up and then do it. In this way, you'll be able to do it in 15 days as well. It is doable. I know once we finish the course, or when you're very much new to PLAB 2, you're like, oh my God, it's too much. Yes, it is too much. But if you go with the proper planning, it's not difficult exam. It's easy to pass and easy to fail as well. So you have to have good guidance, proper guidance, then it's easy. So for example, if you see on day two, we have got some stations on palpitations, PAD, then we have got a couple of stations on cough as well. Then we have got some lifestyle counseling, stroke counseling. Then we have got a couple of breaking bad news scenarios as well. Then we have got pediatrics, OBGY, psychiatry, and then we have got a couple of examination station, and then a simman and a prescription. This is how you should be preparing for this exam, guys. This is how you should be preparing. Do not just practice, okay, let's practice medicine today. Let's practice examinations today. It's going to be too much. I've seen a lot of people, what they do, let's practice examination today. And they're like, let's practice eye, ear, and then speculum, and then testicular examination, breast exam. Let's do all these 4, 5 together in one day. See, it is too much. It is too much. There are many steps. I'm not saying you can't do it, but we are new to these things. For example, if I ask you, how many of you have done ophthalmoscopy or otoscopy in your medical career? I mean, many of us we have never done, or we have done only once or twice, isn't it? So it takes time for us to learn those steps. It should come in sequence as well. For example, like if you're doing eye examination, you're doing fundoscopy, you need to know that I have to rule out some contraindications first, and you can't just do the fundoscopy and then rule the contraindication afterwards. It's not going to make sense, right? So for fundoscopy, you need to dilate the patient's eye. To before you make sure you dilate the patient's eye, you need to rule out some contraindication. For example, acute angle closure glaucoma, because there the eyes are already dilated. You can't dilate them even more. And if you try to dilate, what's going to happen is going to make the patient's condition worse. They will have severe pain. So all these steps, and also, like for example, in eye, we have got so many scenarios when it comes to fundoscopy. We have got scenarios on giant cell arteritis. We have got scenario retinal detachment. We have got scenario on papilledema, ocular toxoplasmosis, retinal detachment. So it's also quite time consuming, isn't it? And when I say eye examination, it's just not eye examination. It has got so many things. And then you've got peripheral field of vision examination as well, where we check if the patient has got tunnel vision or bitemporal hemianopia or homonymous hemianopia. That is also time consuming. So we need to learn all these things. That's why what we have done, we have all the videos as well for everything. You'll find the videos on the Study Genie, and you will see what and how this examination is supposed to be done, and then only you will be practicing with your group the next day. So in the night, just read for an hour or two. You want to see the recorded videos, see that, and then what you do, you will practice. Now, a lot of people, they ask, okay, I mean, how should I know if I'm practicing in a right way or I'm practicing in a wrong way? That's why I advise you guys to attend live online session. If you can't come to the academy, see, the best way to practice for this exam is in-person practice, isn't it? And best thing that you can do, best course that you can attend is in-person course, because in-person course, what's going to happen, you'll be able to practice with the tutor. That's the best thing, isn't it? So when you're able to practice with the tutor, you'll understand how the practice is supposed to be done. I understand a lot of you don't have that much of time that you can spend, like maybe say 1.5, 2 months to the, I mean, in the UK. I do understand. That's fine. So what you can do, you can attend at least live online, live telecast from your home. So at least you'll be able to see others practicing as well. And that will give you an idea, okay, this is how this station is supposed to be done. Now, what also we do in our sessions, that we make some of the student as patient as well. So after the course, when the time comes that you have to practice on your own, you will have an idea how we are supposed to do the practice as well, right? And also, for example, in the academy, when you come, we will have lots of sessions. For example, spam session, where how we are practicing is going to be supervised by our examiners as well. So all these things are supposed to be, like, you have to incorporate it. I saw different notes, but all have some or other mistakes. How to combine different notes? See, the thing is, the main problem that candidates have got nowadays is they have got access of all the notes, isn't it? That is the biggest problem, my friend, right? That's the biggest problem. Please follow one. Please follow one. Now you said there are mistakes. Mistakes on what regard? I mean, I need to know that, because see, some of the candidates think, okay, this notes has got this as the diagnosis. Other notes are saying the diagnosis is different. Is that what you're trying to say? What happens, Dr. Vivek, in these kind of things? Maybe they have given a different history, and different history will make different diagnosis. Another notes, they have got different history, which makes a diagnosis different. That's how it works. Yeah. Read one notes, and if you've got any doubt in that particular notes, and if you feel this is a mistake, ask them. Whatever notes you are reading, for example, I'm not sure about others. If you're reading my notes, and if there is a mistake, what you are supposed to do, you just ask me. Right. So that's why what we do, any candidate, whether you are take any of our course, you'll be added in a WhatsApp group, and you'll be having the access to all the admins and everybody. So what happen is you can always speak to them, and they'll be able to clarify the doubts. Somewhere there is missing steps or types. See, typos, this is, I mean, technically these things can happen, isn't it? I mean, you're a doctor as well, and after a couple of stations that you have read, you'll understand if there is a mistake, you can just let them know. See, typos can happen, isn't it? And nowadays, what is happening, the updates are happening quite like very aggressively. We are doing like the updates every 2, 3, 4 weeks, actually. So yes, while doing the updates, these typos can happen. And I think that should be fine, isn't it? Typos, these errors can happen anywhere. but that's less than 1%. It's not like every station has got those typos. And if you feel, okay, there is a mistake in it, you can always check the guidelines. We have got NHS guidelines, NICE, CKS, and patient.info. These three resources I always tell the candidates to follow. Don't follow any other resource. NHS, NICE, CKS guideline, and patient.info. These three. Because most of us we have done our medical school in from where the American guidelines are being followed, isn't it? So you have to be very careful, because in the UK we don't follow American guidelines. We have got British guidelines. So you have to be extra careful in this regard, right? So yes, typos can be there. So I think that shouldn't be a problem, isn't it? You can just tell yourself, okay, this is something wrong. I need to confirm with the tutor, or I'll just check it online myself. That shouldn't be a problem, isn't it? But do one thing, doctor. Follow one resource. Nowadays, what's happening, I've seen a lot of candidates having 3, 4, 5, 6 academies notes, and they're just reading. But try to understand one thing. This exam is not about reading. If you read too much, it's going to create too much of confusion in your head. The exam is more about practicing. You need to practice, practice, and practice and practice. That's how it is. Record your practice session and see how I'm doing, what mistakes I'm doing, how is my time management, how much time I'm spending on history taking, and how much time I'm spending on the management. Right. So that is the main thing. Yeah. Is this course good for press 3 level 3 as well? Yeah, I mean, see, press level 3, yes, it will cover, I would say, 70 to 80% of press level 3 doctorate. Not 100%, but yeah. How can you practice solo? Good one. I can tell you that why need to practice solo? I mean, come in any WhatsApp group and you'll find a lot of people to practice with, and I think that is best. And if you come in this WhatsApp group, I have just shared, I can put you in Telegram group as well. I've got like maybe 2,000 candidates there, and you'll be able to find somebody to practice with. But I've seen a lot of people nowadays, they practice with the chat GPT. They say like, okay, I get my friend a chat GPT, but chat GPT doesn't have emotions, isn't it? So yeah, you can do it, but I wouldn't recommend. I would recommend per person sitting in front of you you're practicing with. Yeah. Sometimes I can't find a partner to practice with. Is it beneficial to use AI instead? Yeah, I think so. You use as the same thing, especially in counseling and history taking stations. You can. I mean, that's the worst case scenario. You can. But if you try to make a group, it's not that difficult, because you will find a lot of candidates who are I mean, able to do practice in your schedule as well. That's what I'm saying. Try to find those 3, 4 candidates, and that should be enough. But in worst case scenario, yes, Dr. Nasir, I mean, yeah, you can do practice with AI as well. That's not a big deal. Yeah. That's at least you're doing something. Yeah. That's better. But best would be practicing with somebody. That's it. Can we have Telegram group link? Yes, I can send, doctor. If you come in the WhatsApp group, I'll share the WhatsApp group link, and then you can come in the Telegram. And also in the Telegram group, what else you can access? You can access our previous questions as well. For example, last 2 years of recalls we have kept in that Telegram group. So if you come there, I think that will be quite being beneficial for you as well. So, I mean, I don't recommend usually to the candidate that you start checking the recalls from now. But yes, just 1 or 2 weeks before your exam, you can check the recalls as well. When you check the recalls, I would say it actually gives you a bit of confidence. Oh, I have done this scenario, I've done that scenario as well. Oh, that came in 2 days before, that came in the exam. I know this scenario, I know this scenario as well. So when you tick it in your head, it gives you actually a good confidence as well. So that's something that you can do. So if you go to day three again, if you see a cough, uh, we have got all the respiratory like lung cancer, urosepsis, then we have got UTI, a couple of counseling on, again, lifestyle, knee replacement, that's also actually a diet counseling scenario. Then we have got ethical scenario, patient doesn't want to take the treatment. So these are like uh, very good scenarios. These are like patients, they're refusing the treatment or demanding DNAR. Then we have got pediatrics, OBGYN, psychiatry, couple of examination, whiplash injury, it's coming nowadays, right? And then one sim and one prescription. So this is what you do. Do one exam daily. In one line, if I have to summarize today's webinar, do one exam daily. Do something from medicine, something from counseling, something from ethics, examination, one to sim and one to prescription. If you do that daily, you will see after 15-20 days, you'll start feeling much, much better. You're like, yeah, now I can talk for 8 minutes as well. And that's what we really need. Yeah. Do we have recalls as well? Your notes, sir. Do you have recalls as well? Yeah, recalls. As I said, if you come in the WhatsApp group, I can put you in a Telegram group, or I'll see if my one of the admin can send the Telegram group link in the chat box. That's fine. Or if you come in the WhatsApp group after this session, I can just share the Telegram group link there. Because in Telegram, the best thing is you can access the previous messages as well. That's the main thing, isn't it? WhatsApp you can't access, but Telegram is good, like in that sense. So that's why we have a Telegram group link where you can access the previous 2 years of recalls. That's the main thing. Yeah. So this is same for day 4, day 5, day 6. Day 6, for example, if you see, we have got medicine, the lots of like headache station you can do. These are all headache stations. Then we've got smoking counseling. That's what you can do. Then we've got ethical scenario, gender selection. That's nowadays coming. Yeah. And then pediatrics, OBGY, psychiatry, suicide scenario. Then we have got a couple of stations from testicular examination. And then we've got one SIMMAN and one prescription. This is how you should be practicing. One exam daily. We can join groups without subscribing. Yeah, the groups are free to join. That's fine. We've got, see, when you are in our course, there is a separate WhatsApp group where the communication happens and we will keep them updated. Those who are not our students, our regular batch students, we have got separate WhatsApp groups for them. Yeah. Will you send this planner in the group? Yes, yes, I'm going to send this planner. Yes, yes, yes. That's what I was saying. Like, just come in the WhatsApp group so it's easy for us to communicate. Yeah. Now, I have kept some this flashcards as well. Let me explain a little bit about these as well. Does your book hard copy contain all these and updated scenarios as well? Yes. And nowadays, doctor, we're not giving hard copies, printed copies to the candidates. There is a reason because we have to update ourselves every couple of weeks, isn't it? And it's not possible if we print those books because in the UK, when you print these copies, it takes a couple of weeks for us to get those printed ones, isn't it? So when we get the printed one, meanwhile we have updated our material, then it is of no use. Then from last couple of months, actually we have stopped giving the physical books. Now we are giving you the PDFs. We are giving you the PDFs. That's the main thing. Yeah. Do you physical mock classes? I mean, I think you're asking for the mocks. Yeah, we do mocks in the UK. Yes, of course. If you want to attend only the mock session, that is absolutely all right. Sorry, sir. What do you mean with one exam daily? Do you mean a physical examination or the mock exam? I mean, for example, if you see this day 6, I have kept some stations from medicine, counseling, ethics, examination, SIMMAN, prescription, isn't it? I want you to do at least 16 stations daily. Something from medicine, something from counseling, then ethics, examination, one SIMMAN, one prescription. This is what you should practice daily. Don't just practice medicine today. Don't just practice only examination. Practice everything daily. That's what I mean by. I mean, how you should practice one exam daily. Yeah, that's what I mean. So this is your one exam on day 6. This is your one exam. In this, if you see, I've kept the station from all the department, from history, from counseling, from ethics. That's what I need. Yeah. My exam is on 29th May, and if I want to join the course, what timeline should I choose? Like, should I go for the online course now and then 4 weeks before the exam join in-person session? Okay, good one. See, whenever you join the course, first thing what's going to happen is you'll be having the access of recorded course and the notes straight away. Yeah. And then you can attend live online anytime. Even if exam is in May or June, what you should do is first thing is attend our live online session. So you will see others practicing. You will see some of your colleagues becoming patient as well, right? So for example, our next course is starting from 25th of Jan. Yeah. So if you apply now, you can see recorded videos for next 10 days. And then what you do, you just attend that live online session. After that, you'll understand what PLAB 2 is, how I'm supposed to practice and everything. And then what you do for next 1 month, follow this study planner with your group of 4 people. And then you're like, yeah, now I feel very much confident, isn't it? And then what you do 4 weeks before your exam, come in the academy. Now, when I come to the academy, can I attend the live sessions again? Is it included in the session? Yes, of course it is included. So what you do, then you attend those sessions. Yeah, in person. I don't want you to attend the whole course again because you have only 4 weeks. Most time you need to spend in practicing. But yeah, if you want to pick and choose, I want to attend this session, I want to leave that session, you can pick and choose. You can attend SIMMAN, you can attend examinations classes, and rest maybe you can skip as well. And we have got lots of post-course support sessions happening in the academy as well. So what you can do, you can keep practicing in those sessions. You have the mock examiner guiding you and solving your doubts and everything. Yeah. Is this a planner available to us to download? Yes, I'm going to send it in the WhatsApp group, doctor. Yeah. I'll share the link as well. I think I showed as well. Don't worry. But before we end this session, I'll share the link again for the WhatsApp group. If you come in the WhatsApp group, then it's easy for me to share the study planner in the WhatsApp. Yeah. How to access to the live online session? I've already subscribed to the course. I mean, if you already subscribed to the course, let's see the dates, which course you want to attend. As I said, the next one is on 25th of Jan. Just email us, or you must be having any our academy number. I mean, for example, this number. Just message on this number, and we can help you out if you're having any trouble in attending any session. Right, doctor? How much? I'm gonna tell it to you. If I take the course for February and start using the study material and live classes, and 12 days in-person class can be done in June. Yes, of course. This all is included in one-time registration. Yes, and I can use all the study materials and live classes till June or only for 12 days. When you book our full PLAB 2 course, you have the access of recorded course, live online sessions, in-person sessions, mocks, post-course support sessions, till you pass, till you pass, till you pass. So, I mean, you can attend it multiple times as well. I know many of you are working. So the best thing that you can do is maybe attend live online now. And then what happened is when you attend live online, you may not be able to attend whole 12 days in one go because you have got, say, for example, you're working as well. So attend at least 5-6 days, and rest of the 5-6 days, maybe you can attend in the next batch as well. You can mix and match and finish those 12 days, the way it's convenient for you, I mean. Yeah. So should we plan this 30 days plan with live classes? With live classes, it may not be possible. So with live classes, for example, we'll be giving you the schedule in advance, isn't it? So try to follow that schedule with us. For example, whatever I'm going to teach tomorrow, you can read in the night before what we are going to have, right? After you attend that session, we finish at 5 o'clock, for example. Then 5 to 7 or 8 o'clock, you can practice what you have just did today. And then read for the next day so that you'll feel more comfortable in the next class as well. Do that way for 12 days with us. And then you can follow this 30 days planner, right? You can do this 30 days planner in 15 days as well if you have attended those 12 days course, because you have done half of the things already during the class. Yeah. Okay, can you guide? Ideally, everyone says 4 to 6 months time is required for the exam. So considering that June last week or July first week should be ideal for someone who starts preparing by Feb who attend your live classes in May. Yes, absolutely. See, what I recommend is you should have 6 to 8 weeks after the course if you are not working. If you are a working person, I mean, you're going to the hospitals and all nowadays, then you need 4 months. That's true. So what you can do is, yes, you can attend the live courses in May when your exam is in late June or July first week. That's fine. But before that, definitely attend live online by Feb or Jan end or Feb for sure. Yeah, that is going to be a good thing. That's absolutely, absolutely fine, doctor. Yeah. 12 days live online include Saturday and Sunday or just Monday to Friday? No, doctor, it's Saturday, Sunday, everything. All 12 days you'll have the class. After in-person class, can I practice in the academy? Yes, yes, and you have to. I mean, otherwise, after 12 days, it's not like you're fully prepared. After 12 days, you got the idea, this is how I'm supposed to prepare, right? And then you have practiced so many scenarios in the course. In these 12 days, I'll tell you, we practice at least 150 scenarios in these 12 days. So when you're actually done with the course, you have seen those 150 scenarios, you feel very, very comfortable and you feel very confident as well. Yeah. My exam is on 11th March, but I left hospital on 31st December. Okay, I'm fresh as new in preparation is doable. Yes, it's fine. It's fine. 11th March, you said. So you have got roughly 8 weeks. It's doable if you're not working, and you said you're not working. So yes, it's doable. Start today. I mean, don't waste time. Don't waste time. So if you book the course, you'll have the access of recorded course and the notes. Maybe for a week, read, get a bit of idea, see those recorded videos as well, and then attend the course, the next one, 25th of Jan. That's what you should do. Yeah, it is doable. I always say 6 to 8 weeks after the course. That is the recommended timeline for PLAB. Your team share 24/7 access. How can I avail for practice? Yes, so if you're staying in our hotel is like 65 bedrooms, right? We have got, and all our students, mostly they stay there. And this hotel is only for PLAB candidates. Nobody else can stay. And all the mannequins, and then if you're staying in our hotel, you have the mannequin access 24/7. Right? That's the good thing. I know many of you want to read and practice in the night, because many are night owls as well. Somebody's like, a lot of you are morning person, a lot of you are evening night person. So doesn't matter if you're living in our hotel, you have 24/7 access to the mannequins, right? So yeah, I mean, you can decide how so you wanna do. 6 to 8 weeks after the online course or the offline course. See, I would say any course, even if you have done online live course, after that, if you have got 6 to 8 weeks, that is fine. But Dr. Tiwari, for example, if you come, you have to come to the academy at least 1 month before. In that 1 month, you are practicing. But any of the live course is happening, what you can do is you can pick and choose and attend few classes rather than attending the whole course again. Right? So even online, or I mean 6 to 8 weeks after any course, that should be fine. So when you come here a month before, at least you can attend some classes. Yeah, I booked for April 2nd, and I'm not sure I can travel out of London easily. There is no chance to do some practice here. How can we do practice on how, and can we do practice only subscription? Yeah, we have got small courses as well. If you want the practice only, the mocks only, yeah, we can help you out. Just do one thing. Email us or WhatsApp on this number, and our team can share things. Or if you come in the WhatsApp group, our team members are there, and that's going to be easy for us to communicate. Yeah. What about those not living in your accommodation? Yeah, that's fine. So if you're not living in our accommodation, then the time is limited for you. So it's going to be from 9 to 7, 9 a.m. till 7 p.m. You will be having the access to the academy. See, it's just like any hotel for the security purpose, and it's a winter time as well, isn't it? So it's always good that you go to your accommodation before 7. So that's what we do. So 9 to 7 will have the access, but those who are staying in that hotel, they have 24/7 access. Yeah. For somebody having exam on 29th of May, 29th of May, I'm planning to attend live in person April 20th and doing 2 in-person mocks in May. And in the meantime, doing the live course, is that okay? And the revising also is worth. Okay. So yes, doctor. So your exam is on May 29th. You are planning to attend in person from April 20th. That's fine. But before that, attend one live online session for sure for 12 days. That's fine. That's perfect. PLAB 1 material, you don't need to read again. You have already done that, and whatever gonna come in PLAB 2, we're gonna prepare you for. So you don't need to worry about anything. You don't need to come prepared. You just come blank to me. I want you to come blank. Don't come with any preparation. I'll prepare you. Don't worry. Yeah. All right. How do you enroll? Just come in the WhatsApp group and we can help you out, doctor. Yeah. Is the accommodation including in the course fee? Of course not, doctor, because I don't know how many days you wanna stay, isn't it? So course is separate, accommodation is it's a separate thing. Yeah. Are any mocks included with the course? Yes, two mocks are included. Let me just finish this PDF quickly, and then I'll answer these questions. Yeah. I was talking to you about these flashcards as well. So when you book our course, you'll have the access of these flashcards as well. So what we have done in the flashcard, every station we have finished in this half page. So for example, what is SAH? What are you supposed to do in data gathering in SAH station? What are you supposed to do in the management? And what are they looking for in terms of IPS? And what are the main patients concerned you'll have in the exam? So this is how we have actually prepared these flashcards as well. So you'll have the access of these flashcards as well. You'll have the access of the material. You'll have the access of these flashcards as well. And trust me, these flashcards are quite helpful. Just maybe quick revision if you want to do 2 weeks before your exam. So then you can have a quick revision through these flashcards. Yeah. So there are quite a lot we have made, like tension headache. This is what you're supposed to get. Hangover headache. Right. Okay. So day 7. So again, we have got some stations from medicine, some station from counseling, then some station from ethics, then OBGY, gynae, psychiatry, examination, SEMMAN, and prescription. This is how you should prepare. This is how you should prepare. Don't just prepare one topic for one day. No, you have to prepare everything together. How much we need to pay for flashcard? Can you give us with the course fee? You will get flashcard with the course fee only, doctor. There is nothing extra that you have to pay. So this is for the 30 days planner. Let me go through it quickly. So 16, day 17, day 18, then day 19, and all these things, this sequence is according to our Aspire book, so you can easily follow it. It's not going to create any problem for you, right? Now, once we are done with the 28 days, 29 and 30 days, so it's done. Now, next 3 days, I have kept some new station and very important scenarios afterward for 3 days. If you see these are the new stations. These are new stations and new stations. So, like for example, female genital mutilation, herpes zoster ophthalmicus, arrhythmia beginning, and Down syndrome counseling, vaginismus, endometritis. So these are comparatively new stations. So I've kept these new stations in the end for this study planner as well. Yeah. Could you please repeat how to plan according to the day wise and for practice as a group? Yes, I'll repeat that quickly as well. Don't worry. And these are some flashcards we have got for ethics as well. Yeah. So, doctor, what I was saying is, so for example, you have attended our live online classes. Now you have got, like you want to prepare. You have got 2 months before your exam. So 1 month, I want you to follow this study planner. What you do, make a group, 4 people, 2 males, 2 females, preferably. If you have all female or male, that's fine. What you do is in the night, 2 hours, you want to read those 17, 18 topics, you can read. You want to see the recorded videos, you can see. So make sure you're fully prepared. And the next day, what you do, all 4 of you sit and you practice those stations with each other, right? So you've got like at least practice one sim man, one prescription, one examination mannequin, 2, 3 history, and one counseling, one ethics. So if you practice, each one of you practice 6, 7 station, that should be fine. And that can be easily done in 3, 4 hours. So 1 to 2 hours of reading and 3 to 4 hours of practicing daily. If you do for a month, you are actually prepared for your exam. That's what it is. It's not difficult. It is doable. What I've seen, the main problem nowadays that candidates have got, they read the material from all the academies. I'm not saying their material is wrong or their material is not good. Everyone has written their material from NICE, CTS, NHS guidelines. Please follow one. This exam is not about just reading. This exam is about practicing. You need to practice. So please spend time in practice, right? If I join your live classes, but miss 1 to 2 days in between, so do I get the recorded sessions? See, you always, when you book the course, you'll have the access to the recorded sessions separately. And if you miss any classes, because our live sessions, we don't record. We have already recorded and given it to you. But if you want to attend any of the classes in the next batch, you are free to do that. No problem, no extra payment for it. It is overwhelming to do all the materials. So please don't do it. That's the biggest problem candidates have got nowadays. They are reading the material from all 4, 5, 6, 7, 10 academies, and then it mess up their head actually. Don't do that. Don't do that. Don't do that. Can I combine my study plan with PLAB 2 gems from Plabable and use Aspire books as well? You can do that. Again, I would say one thing, follow one. That's my sincere advice. Yeah. That's my sin. Plabable is my friend. Z is a good friend of mine. Yeah, we have done our Plab2 together only. So yeah, you can do it from Plab2 gems as well, and then get more ideas in Aspire books. That is something that you can do. But I again recommend if you attend our live online session, I know you are sitting in your country, but if you attend our live online session first, you actually get the idea how you are supposed to prepare for this exam. That is really important. Yeah. Now, so I think let's summarize what we have just discussed. So what we have is in our full PLAB2 course, what is included? You can attend our course as many times as you want. If you book the whole course, what you will have in-person sessions as well. Yeah, you will have online live telecast of these sessions. You will have the notes as well. You'll have the access to pre-recorded videos. Somebody was asking me the mocks are included as well. 2 mocks are included. Mannequin practice 24/7 if you're staying in our accommodation. Simman practice every week. That happens. You can join. Post-course support session, academy access 24/7. All these things are included. So our course price is actually 649, guys, 649. But if you are a Plabable subscriber or a group of 5, so if you are both of these, then we can give a discount of £120 and we can book the course in 529 monthly, right? If you come in the WhatsApp group, we can tell you in more details as well. What is our post-course schedule? I'll just go through that quickly as well. Post-course. So our 12 days courses are happening. Yeah. So these are our course dates actually. So the next course is on 26th of Jan, not 25th of this, 26th, sorry. So these are the 12 days course dates. So that is for February, March, April, May, June, July. So I've given the dates for the next whole year, right? Now, the course is happening 12 days, but in the other rooms, we are having these post-course support sessions happening as well. What are these post-course support sessions? So for example, every week we have got hands-on mannequin. What we do, we divide you in small groups, and we keep you in 4 different rooms. And what happens is you'll have a different instructor in that room. So in 1 hour, what you can do is you can practice on those mannequin, and the supervisor is just there watching you, and if you make any mistakes, they can easily correct you. That's how it is done. Right. Then spam session. What happened is this is spam session. This is happening. If you see this photo. In this, what simply happened is you are actually practicing with your colleagues and with our mock examiners. You know, whenever a lot of candidates, they come to the academy, they're like, I'm not finding a practice partner. How can I get a practice partner? In these spam sessions, you are going to practice at least 10 to 12 stations with 10 to different people in 2 hours. So you'll get, I would say, 10, 12 different friends. That's the main thing. Yeah. Then we have got prescription writing session happening every week. Then we have got mannequin teaching sessions happening every week. Spam, sim practice. All these sessions happens every week. Our course is happening as well, and these sessions are happening as well. And when you're in the academy, you're free to attend any session. You want to attend these post-course sessions. You want to attend our like live sessions. You can decide what you want to attend. There are a lot of activities happening in the academy on daily basis. Yeah. Okay. This is like a supervised mannequin session is happening with a small group. This is teaching sessions happening. This is spam session happening. Yeah. Okay. So these are our batch dates. Come in the WhatsApp group. Let me take some questions. I have exactly 5 weeks from now. I still haven't been able to study the whole PDF. You don't have to study whole PDF in one go, doctor. And the whole PDF, and haven't purchased SIMMAN procedure examination teaching stations. And how do I from my home in the best possible way? See, doctor, only recommending is first attend live online session. Once you book our course, you'll have the access for the recorded and the notes. And what I want you to do is attend the next live online session, which starts from 26th. In that 12 days, we'll be teaching you everything. Examination, simman, prescription, history, counseling, ethics, everything will be taught. And then you will understand. And then read a little bit and practice it as well. Don't just keep reading. That is of no use. So don't read everything in one go. Try to follow this study plan. Yeah. Would taking the live session depends on the exam date? I mean, for the addition of new cases. See, for the new cases, doctor, we do regular webinars. So you don't need to worry about that. You don't need to worry about that. Like we will be sharing our material and we'll be doing the webinar to keep you guys updated. So you don't need to worry about that, right? So you will have that access. So if you attend the batches now, for example, your exam is in May and you attend the batch in February, so if something came new in April, how you will get to know? You are in our WhatsApp group. You will be notified, okay, we have a new station webinar. This is a new station PDF. Everything will be shared with you. So you don't have any trouble at all. Yeah. Do we need to separately book these post-course sessions? No, you just come into the academy and speak to the admin and they'll be able to guide you. No problem. And recommend booking extra days accommodation for these. Yeah, so I mean, so you're gonna come after the course, you're gonna definitely, I want you to stay for 3-4 weeks. And in these 3-4 weeks, you can attend these post-course support sessions and you don't have to book them separately. You can just speak to the admin and they can help you out. What did you say, please, about missing 1 or 2 days in the live online? Can someone get the recorded session? Recorded sessions are different, that you will be given. But if you miss any of the session, you can attend in the next batch. That should be fine. See, during our live online sessions, what we do, we practice with the candidates as well. A lot of them, they're not comfortable sharing their video. So that particular part will not be shared, right? But we have the recorded session that I and Dr. Nikhil, we have recorded it for you. So you can see those topics from those recorded sessions. Yeah. So should I make notes, or is it enough just read and practice? Just read and practice, right? And you will have the notes in your PDFs, for example. So you can just maybe jot down things on the PDFs, and that should be fine. And some people, they have habit of making notes. That's fine. You can make some notes, a small booklet. That's not a problem. But not really, I mean, 100% required. Yeah. If you miss some days, because of some work and all, can is this be filled up? Yeah, I mean, so what you can do, you can attend those missed classes in the next batch. That's not a problem. After attending online and then coming for in person, can I practice in the academy till my exam date? Of course, you can practice in the academy for a month, 2 months, 3 months, 6 months, no problem. I've already enrolled in the course, so asking how to do the other station except the history from home. Any way you suggest for my preparation to be most effective? So what you do, you have enrolled in the course. Have you attend any live online session, doctor? If you attend live online session, we can put you in a WhatsApp group, and what happens is you will get some practice partners as well. When you get practice partner, that's what you need, isn't it? So then it's easy for you to follow this study planner. Is it possible to purchase just a face-to-face mock test with SimMan station included held in the academy? Yes, you can do the mock, and every mock we have one SimMan station. So yes, that can be done, no problem. Doctor, can you add me in the discount group of 5 PLAB for availing? So if you come in this, if you just scan this QR code, this one, and we can do that. And yeah, how much do I have to pay after discount? Is 529, doctor. So if you come in this, you will be notified. Yeah. Any more question, guys? And this, I'm going to share with you guys this study planner and all the new stations. You asked me like how you're going to be telling us about the new station. I do update now. I'm kind of from last 1.5 months very active on social media, especially on Instagram. So if you follow me, Dr. Ankur Garg, and you will see a lot of small videos for the new stations as well. Any doubt, you can ask me there as well. No problem. Just check it. Check this channel, Dr. Ankur Garg, and you will see all the new station videos. I've kept it there as well. So you can access whenever you want. So that's kind of very easy as well. And yeah, and WhatsApp group, I'm just sharing this link. Yeah. And CJ, our admin. So if you can share the WhatsApp group link, CJ, in the chat box as well, please. Does the 12 days includes the weekends? Yes, doctor, it includes weekends as well. Been watching your pre-recorded videos of practical procedures. They're really helpful. Thank you. See, just don't see the videos. Videos are helpful, but doctor, you have to practice as well. And that's the main thing. You have to do both the things, I mean, yeah. So reading only will not help. Only watching videos will not help. Read, see the videos, and then practice that thing as well. Please mix it up, then you will see things will stay here for longer, right? Otherwise, if you see some videos and all, after some time when you see the new videos and all, what happened, the previous one will start missing on out. So that's something we need to work on, yeah. I'm acting like a student, so yeah, yes, you're a student. Yeah, so what's the problem? Yes, Dr. Shreya, yes, yes. Yes. What's the website? I found two regarding Aspire. Yeah, we have got two websites, doctor. Both are ours only. www.aspire2plab.com, and then we have got www.thestudygenie.com. So Study Genie is our platform where we host all these videos, right? So our Aspire, and when you try to book the course, it will take you to the another website. So the Study Genie is our what do you say? Study Genie is our web application. Yeah, so both are ours, doctor. Both the website are genuine. Aspire2plab.com and thestudygenie.com. Both are our websites. What's the pass mark range for each station? It's roughly 6 nowadays, doctor, out of 12. I understand that it changes with the difficulty level. Not really. Nowadays, if you see last few months, they have actually made it almost the same. So each station is of 12 marks, and the passing score roughly is actually 6 out of 12. Some station passing score could be 5, some station it could be 7 as well. But mostly it is 6 nowadays. Yeah. If you practice, how can we assess ourselves, and how to get a good advice? So that's what I was trying to say. in our course, live online session, if you attend, I'll be making some of you patient as well. I'll prepare you as a patient. I'll tell you what are the things you need to look for. So that's quite helpful. Moreover, we have got these spam sessions happening where you're going to practice with your friends, and our mock exam is going to be there as well. So that's going to be quite helpful for you to know if you're practicing it in a correct way or not. Yeah. How many stations do you need to pass this exam? So nowadays, doctor, it's not very clear how many stations you need to pass. They said we will decide on every day basis how many stations you need to pass. Before that, it used to be 10 out of 16 stations. Now also, if you're passing 10 stations, mostly candidates are passing the exam. But there is no fixed number nowadays. Yeah. I joined this session just now. Will you be able to conducting these sessions again? Yes, of course. And I'll see if I can share the recorded videos for this session as well. That's not a problem. And as I said, we'll have every week some practice sessions as well. We'll share things and details, more details with you guys soon. Yeah. I joined this. Okay. What is the pass mark score for Aspire? What do you mean? Your past track record from your students? You mean the maximum score or what is it? So maximum score, I mean, so the total is 192. Our maximum score, I mean, what I know is we have got candidates getting around 150. There are many students. Yeah. We had one candidate from Saudi when we used to have 18 station. The total was like 216. He got actually 186 as well. So it was a very high score as well. How many candidates roughly passed from us in the first attempt? I won't say like all 100%. So our passing score is like 75 to 80% candidates they pass in their first attempt. Then those who are not able to make it in first attempt, they pass in second attempts as well. So that's how it works. Yeah. Okay, so guys, that is it from my side. If you've got any specific questions, just let me know. Yeah. Any chance for downloading study planner? We're gonna send it to you, doctors. Don't worry. After this webinar, I'll send it. If you're running out of time for a particular station, what is the best strategy? Rush through the leftover parts such as safety netting, leaflets, keep the same pace and leave things parts. If you're running short of time, just do one thing. Ask the patient what you want to know. What are your expectations from this consultation? That is the best thing that you can do, doctor. Yeah. First of all, trying to be a bit quick in your history so that you have enough time. But yeah, you're right. You can be in that kind of situation where you've got very little time left in the end. So what you do, the best thing is do ICE, idea, concern, expectation. Ask the patient about the expectation from this consultation. That's what you do, right? Don't rush and do what patient wants you to do. Yeah. Anyone interested for the group discount, please DM me. Okay. How do we plan the timing for a follow-up station? Like how much time for history and management? See, mostly follow-up, the diagnosis is already made. So I would say for the compliance, if the patient is compliant or not, if the patient has got any symptom nowadays and all, you can ask those things very quickly. Shouldn't take more than 3 minutes, I would say. And then 5 minutes, you can easily do the counseling and the management. Yeah, if it is history station, I say 4 and 4. But if it's more of a counseling station, maybe less time for history and more time for the counseling. So 3 and 5, that's what you can do, Dr. I know. All right. So, yeah. Group discount, do we have to have the exams on the same day or month? Not really, doctor. Not really. It's just you book it together, but your exam can be different months. Not a problem. Yeah, that's absolutely, absolutely fine. Yeah. Any more questions, guys? How to open a telephonic consultation if patient relative call you first? See, usually what happens is when they call, they usually book an appointment and then it's you who's calling the patient, right? So how to open? You need to ask their name. First of all, 3 identities. You need to confirm their name, their date of birth, and their address, right? And then you introduce yourself as well. And then you confirm if it is a good time to talk. You have to see if they're in suitable place to receive your telephonic call. Are you able to hear me clearly? Just do these things in the beginning and then you will start. Yeah, that's how it is done. Sorry, the question, no problem. Does the book sold by Aspire contain all the info required to take PLAB 2? Yes, including physical examination procedures and man-K. Of course, everything is included. Any new station comes, then we have a separate new station booklet as well. So whatever comes like in last 6 months, a very important one, we put separately in another PDF as well. But otherwise, everything, history, counseling, ethics, examination, seminar, prescription, everything is covered. Yes, you're absolutely correct. Are we likely to get this recording and study plan? Yes, yes. If you're in the WhatsApp group, we're gonna share things in the WhatsApp group because it's easy for us to share, right? So yes, you will get. Any tips to cut down time on history taking? Yes. The main thing that you have to do when you are doing history taking, please do not ask every question from past medical history, lifestyle history, and social history. You need to cut down lots and lots of questions there. That's the main thing. Yeah. Very sincere advice. And do ice a bit early in the station. That will solve a lot of problems and will save a lot of time for you. If there's a diagnosis already, should we rule out the red flags again? Yes, the diagnosis you already have, at least rule out the complications of it. Yeah, so yes. Or just ask for the current symptoms. If you're asking current symptoms, that's kind of ruling out complications. And maybe one or two red flags, complications, you can rule it out as well, right? That's the thing. And move on to the management. Exactly. And also, should we do examination like any other history station in case of a follow-up? Yeah, of course. See, if a patient comes for a follow-up in your clinic, do you do the examination again? Of course, we can do that. That's not a problem. So in most of the station, they want you to mention about examination. Only in some station, they will let you do examination. Some station, you just need to mention it. When you mention the examiner might be able to give you the finding. That's how it works. Yeah. Last question from my side. In some of the Aspire notes, I've noticed that some info is already provided in the patient info. And still there is a question such as what makes it worse? Would not this be seen as poor listening? I've noticed that some info is already provided in patient info. Okay. And still there is a question such as what makes it worse? Okay. You mean like while doing the history, that question has already been answered. Is that what you're trying to say? In some of the Aspire notes, I've noticed that some info is already provided in the, okay, in the patient. Okay. And still there is a question that, such as what? Yeah, see. Uh, how to read the notes? It's not like you have to read bit by bit. See, when you're practicing in your group, we have just given you an idea. This is how you can practice. But I never say that you have to follow the notes. What we always say is you have to read actually the management only. Read the management. History, you just have to practice on your own. If you know this finding has already been given, then you don't need to ask that question again. Come on, that's something, yeah, you can manage it. Yeah. Now I think if you, I don't know if you have the latest notes and all, in the latest notes, you will not see many of these mistakes. We have, I think, corrected most of it. If there is any, let us know. I mean, we can look into it and rectify those things. Yeah, I think that's not a big deal. Yeah. Do we have to practice all the procedures or examination that's mentioned in the PDFs, or there are something more important than others? Yes, there are something more important than others. Yes. And during the class, well, when we teach, we'll let you know which is the most important one and which are not coming. If I tell you, like for example, a hip examination not coming nowadays, brachial plexus injury, it's not coming nowadays. So there are a few stations, I mean, which are not coming. Knee examination not coming nowadays. I can tell you which station coming, which station not coming. So when you attend the courses, I mean, we can go in more detailing of these things. Yeah. If we don't do a job at, if we don't do a good job at covering differential, will that affect our marking? Yes. See, it depends on station to stations because in some station you have to rule out some differential, in some station you have to rule out many differentials. Yeah. So if you, what I believe, if you do a very good, what do you say, Socrates or Odipara, if you elaborate the presenting complaint nicely, you will see, doctor, you have ruled out so many differentials already. So doing a good elaboration of presenting complaint will solve a lot of your problems, right? And then accordingly, you will see like, okay, how many differentials I have ruled out. If your diagnosis is a red flag diagnosis, if your diagnosis is a heart attack, you don't need to rule out many differentials. But if your diagnosis is musculoskeletal chest pain, you need to rule out so many differentials. That's how it works. And yes, if you have not ruled out the red flag killer differentials in the exam, it's definitely gonna affect your marking. Where is Academy and how far it's from the exam center? We are in Blackpool. It's roughly an hour from the exam center, doctor. When is the next live batch starting? It's from 26th of Jan, doctor. 26th of Jan, our new batch is starting. All right. Perfect, perfect, perfect. So, yeah, join this group and yeah, I think, yeah, there are some candidates have already made a, what do you say, the group already, the group of 10 people, yeah? Group of five, I guess, yes. That's nice, that's nice. I won't have much time after the course for exam. That's okay. So when is exam, Dr. Anamika? Just tell me when is exam? If you can mention the exam date. 25th Feb. That's correct. So if you, I mean, have you booked the course already or not? So if you book the course, what you do is you start because the exam, the next batch is starting on 26th of Jan. So you have like roughly 10, 12 days now. So what you do is in these 10, 12 days, uh, see the recorded videos, some of the recorded videos and read the material accordingly. So see some videos, read the material. And then if you book the course now, what we can do is maybe we can put you in a WhatsApp group of the current batch because our current batch is still going on. Today the batch is happening and then Thursday and Friday, 2 more days left for the current batch. So maybe we can add you in the current batch and then you will be able to have the access of that WhatsApp group. You can practice with the friends, maybe from this group as well. Obviously, when you attend the next one, you'll have the access of that WhatsApp group as well. So that's something that you can do. So start today, start today. It's doable because 25th Feb, meaning you have got 6 weeks. Uh, Not like you can't do it. If you have got nothing else to do in your life, just PLAB 2, you are able to do it. You definitely can do it. Yeah. So yeah, start today. Start as soon as possible. Don't delay things. That is the main thing. Okay then. Any other question, guys? Any other question? Does the book also include these notes to study? And what year is it, please? And how long would you recommend to fully prepare from scratch after a long a gap? See, the book covers everything. It covers everything: history, counseling, ethics, everything. It's gonna cover examination, sim, and everything will be covered. How long would you recommend? If you are working or if you're not working, it depends on that. If you are a working person, I would recommend 4 months. If you're not working, after the course, if you have got 6 to 8 weeks, that should be fine. I know you can't spend 6 to 8 weeks maybe in here in the UK. So what you do, you attend it live online from your place. And then you will see, you'll get the idea about PLAB. Then you will start practicing online with your friends. And then you can come to the academy and do the mocks and attend some more sessions and maybe practice on the mannequins. And that should be okay. Doesn't matter how much gap you have got. I've got a lot of candidates having gap of more than 10 to 15 years as well, and they're now working in the hospital, they're working as a GP. So that's not a problem. Gap, not a problem. It's not a problem. Yeah. All right. Okay, guys. Anything else? Any other question? Anything? Yeah, and we have just shared the WhatsApp group link as well. So just come in the WhatsApp group if you are not there already. Yeah. And as I said, for the new stations, uh, just keep checking our social media. I mean, because we do the news stations webinar time to time. Yeah. Telegram group link. Yeah, I'll share the Telegram group link once I'm done with the session in the WhatsApp group, right? So then everybody can join the Telegram group. Please, admins, please share the Telegram group link as well in the WhatsApp group. Yeah, we'll share it. No worries. We also provide one-to-one coaching feedback during the preparation. Yes, I mean, what do you say? In the class, that's what's going to happen, isn't it? So one session, yes, we have got that facility as well. If you want more detailing on that, yes, definitely we can mention that. Yeah. And yes, you have just shared the Telegram group link. Yes, doctor. You can just check it in the WhatsApp group. Are the mocks the same level of difficulty of a real exam? See, we try to, I would say, give more difficulty in the exam. It's not that difficult, to be honest. But we have told our mock examiners to be a bit more difficult. I mean, so our examiner will try to be more difficult with you. So yeah, that shouldn't be a problem. If you can manage us, you can definitely manage the patients in the exam. Yeah. Kindly share the study plan. Yes, Doctor, I'm going to share this PDF once we are done with the session. No worries. Yeah. Who will be the faculty for the classes? Doctor, it's you and I and Dr. Nikhil. I'll show Dr. Nikhil. I think I have his picture in some of the. Yes, he's here. Dr. Nikhil. So we'll see him with the big man, Sim man. I'll do most of ethics, medicine, and examination, and you'll see him doing Sim man prescription stations. Yeah. So most of the sessions are done by us, and we have got other tutors as well. Maybe 1 or 2 classes they'll be taking, but most of the course is done by us only. Yeah. Can we practice with you when we are in the class? Of course, that's what we do. That's what we do. Like, for example, when I teach, say, ethics, I practice at least 15 stations that day. When I do psychiatry medicine, I daily practice 10 to 15 stations daily. So you'll practice at least more than 50 to 60 sessions with me. And maybe you will get a chance to do 2 to 3 stations with me. So that's how it works. Yeah. Can you share the post-course schedule for complete year? No, it's not for complete year. It's every week. It's every week. It's almost the same. Uh, 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 uh. This is every week. It's almost the same. Right. So, I mean, of course, when you come to the academy, we hope you'll spend at least more than a week, isn't it? So in that 1 week, we make sure hands-on mannequin, prescription writing, and simman and teaching, that's going to be covered. But yeah, the dates, for example, for the teaching session, for the simman practice can be a bit more like fluctuating, isn't it? It depends on the availability of the tutors as well. That's what we usually check before we actually announce it. So that's why we announce it every week. Yeah. What is the spam session? Spam session, actually, we try to make sure that you practice with 10, 12 different doctors and with our mock examiners as well. So it helps to build friendship, I would say, and you'll be able to find more doctors to practice with. So that's what is happening. So you will be sitting in front of other doctor and practicing. And then you, after 10 minutes, you'll change the position and practice with a different tutor. So that's how it is. Yeah. It's quite helpful. It's quite helpful. Our examiner is looking for similar responses as those in the notes for repeated scenario. See, um, I think in PLAB 2, everybody will have a bit of different answers. For example, patient has lost his vision. Patient is asking a question. It's a GCA scenario, giant cell arthritis, and patient is asking, doctor, am I going to get my vision back? See, I think every candidate will have their own way of answering. They have their different answers. So I think it's not a problem. And obviously, the answer is not going to be different because the guideline says it's less likely to get the vision back in giant cell arthritis. But then how are you going to present? For example, if I'm the student, I might say, oh, I can see you are worried about your vision loss. It's a genuine concern. A good thing is you have come to us now. So we'll start you on the treatment. We can prevent it from happening in the other eye. But I'm really sorry, it's less likely to get the vision back in this eye. That's my answer. The way you will answer will be slightly different. The way other person will answer is slightly different. So it's different, but eventually the meaning is kind of same, isn't it? So that's what you do. Yeah. The problem in real exam is the stress. Yes, that's true. I don't think online will mimic real life what we do. And there is no chance to practice here in London, even if attachments in hospital, to see only if you had access to any person in London hospitals. Right. So, yeah, I mean, that's true. I mean, exam is stressful. But then, of course, if you do the mock, doctor, mock, I won't say it's same stress like the exam. Exam stress is completely different. Yeah. So, yeah, I mean, that's why no, we always recommend candidates to attend in-person classes. In-person classes and live online is completely different. But then I know a lot of you are working and all, it's difficult to have that much of time. So that's why, I mean, what we can do. Yeah, you can attend live online and then maybe in person. All right, guys. So that is it from my side. Yeah. So I hope you all of you have come in the WhatsApp group. Yeah. Any more question, guys? Any more question? Any question if you've got regarding the group, like group discount? Any questions if you've got, I can just try to answer. Face-to-face classes, how many times can we attend? Doesn't matter. I mean, how many times you want to attend, you can. That's not a deal. Yeah, as many times as you want. That's not a problem. Yeah, free to attend as many times till you pass. Again, doctor, this exam is not about attending the classes again and again. From our side, you're most welcome to do that. But my recommendation is spend more time in practicing. That's what is the most important thing. Yeah. Can I practice prescription from BNF app? I don't have any hard copy. You can, but then obviously in the exam, usually they have got the BNF book. So when you come to the academy, you can just check the BNF book as well for a couple of days. At least get yourself comfortable with the BNF actual book as well, the hard copy. So don't worry, when you come to the academy, you'll stay for a few days, I hope. Yeah. And then on the daily basis, spend like 20 minutes, half an hour with the book daily. So you get comfortable with the book as well. Yeah. Do we get to discuss regarding doubts after class, even after 12 days? I'm planning to stay 6 weeks. Of course, that's why we have got these post-course support sessions. So you can ask the doubts. That's, of course, most welcome, doctor. Yeah. What else? What? Any doubt, please ask in the WhatsApp group as well so we can answer. And I'm going to send this in the WhatsApp group, the study planner and everything. I'll be sharing it in the groups now. Right. And yeah, and as I said, we'll be having the session soon, kind of every week for you guys, just to practice. Yeah. How Aspire is different and help us to pass. How Aspire is because we are the only one doing the courses. Nobody else is doing the course. The 12 days course, for example, we are doing, nobody else is doing. And I think live courses are important for club too. Yeah, that's the thing. I think you don't need any other explanation other than that. Lots of other academies, what they do, they just have this post-course support session, and this is what they're saying, it's their course. No, that's not my course. That's just free included with the course. Our 12 days session makes us different from others. Yeah. Will there be someone to assess us during the practice, even when there are classes going on face to face? Yes, during these schedule. No, that's what I'm trying to say, doctor. So 12 days classes separate. Then there's a practice area as well where you guys practice on your own. But then every day you'll have these post-course support session where all these sessions are supervised. Whether it is teaching session, sim and practice, prescription writing, spam session, these sessions are supervised, and you have a couple of mock examiners. They are actually assessing you. Yes, but not like for the whole 12 days, isn't it? I mean, not like the whole 12 hours daily. Somebody's gonna be there to assess you. No. So every day there will be designated time, like from 5 to 7. From these 2 hours, there will be somebody there who can assess you and guide you and give the feedback accordingly. Yeah. So that's, yes. Right, guys. So that is it then. And so we'll see you guys in the academy. And then any more questions, please put it in the WhatsApp group. Yeah. Online and in-person class, same schedule, right? Yes, of course, because it's the same session that's live telecasted. Yeah. So whatever we're doing in the academy, that will be live telecasted. So timings and the sessions are going to be the same. Yeah. Right, guys. So that is it. So join the WhatsApp group, join us on Instagram. We have got 2 Instagram channels. So one is mine, one is Aspire Education. So please join both. Dr. Ankur Garg, Aspire #2 Education. Yeah. So all the news stations updates and all you can see there as well in terms of small videos. If you have joined us, good. If you have not, please join us. That will be quite helpful. Right. And yes, then that is it. How long are the sessions each day? So usually we start at 10 to 5, 10 to 5, and usually we have got like 1 hour break in between. So 10 to 1, then 1 to 2 is break, and then 2 to 5 roughly. So roughly 6 hours class and 1.5 hour break. That's how it goes, doctor. Roughly, but some days it can go a bit longer, some days it can finish a bit early as well. It depends. So 10 to 1 and then 2 to 5. Right. So, guys, once you enroll into the course, I'll just summarize it. First thing, you start with the live classes, live online classes. Yeah. And then meanwhile, you can see the pre-recorded videos as well. You can go through the material as well. So what happens is you will feel prepared when you actually come to the UK if you're done with these things. When you come to the UK, you'll have the access for in-person classes, 12 days. You can attend it again, whole of it. If you feel you have got less time, you can attend only the few classes which you feel the most important ones. Practice with the faculty during the class. Then you do the post-course support sessions as well till you pass, and then give the mock exam 1 to 2 weeks before your exam. So that is how you should be preparing. Yeah, that's how you should make the plan. Do you suggest me to attend the whole 12 days from start to end, or is it better to attend only the practical stations? So from when you attend from 25th, doctor, attend the whole of it. Yeah, if you're attending in person, yeah. So you can attend whole of it because see, we are taking 6 hours from your time, yeah. And then what you do, you have got enough time in the day because there's 24 hours. So you can give 12 hours to this exam. So 5, 6 hours if you attend the classes, rest 4, 5 hours you can still practice. So I would recommend at least attend once fully, properly. It might be live online or it might be in person. That you can decide. That's not a big deal, but please attend the whole of it at least once. Yeah, that would be recommended. Yeah. All right then. Okay, guys. So that is it from my side, and I'll just share this study planner now in the WhatsApp group. Any other questions? I'll be there for a couple of more minutes. Yeah. Any question? Just let me know. Have a great day to you, doctor. All the best, everyone. All the best. All the best. Good. Right. So that's the WhatsApp group link. You come, we can have a communication. I mean, it's easy communication. Yeah. All right, then. We'll see you guys in the academy soon. Yeah. Thank you. Thank you, guys. Thank you. Take care. Take care. How soon can I come to the UK for on-site preparation for the exam? You decide, doctor. Anytime. You're gonna spend 1 month, 2 months, 6 months in the academy. It's entirely up to you. We are not the one who's gonna tell you, right? We usually say, I say, like, if you've got 4 to 6 weeks in the academy, you'll be feeling more confident, right? It depends on person to person, but there is no restriction from our side, like you can practice only for 2 weeks or 4 weeks. No, there's nothing from our side. It's you who's gonna decide. Yeah. Okay, then. Right. There's one more question. How can we get 30-day study planner? Don't worry, I'm gonna send it in the WhatsApp group. Right, guys, take care and enjoy the rest of your day. Take care. Bye-bye. Bye. Bye. And yeah, I mean, if you have missed it, so we will share the recording with you guys as soon as possible. Yeah, stay in the WhatsApp group, so you'll get a lot of things in the WhatsApp group, and it's easy for us to communicate. All right, final bye. Take care.